Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. Our number in the studio is 866-870-5752. If you're experiencing any kind of chronic musculoskeletal pain, that's basically orthopedic pain like joint pain, hip pain, back pain, disc pain, arthritis pain, give us a call. The number again is 866-870-5752. And check out Dr. Darrow's website at www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. And remember, when you phone today, you get the free book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. This is Dr. Darrow's latest book, and it has 264 scientific studies, and the foreword was written by Suzanne Summers. What do you think?
I love it. I want to mention a couple other things. One is that I do hair regeneration. I know that sounds weird, right? You can regenerate hair.
Not really.
Using platelets and stem cells. And the back of the book that I wrote has a chapter about that and the studies on it. And one of the things that I do when I do hair regeneration is to check people's hormones. Because there is a lab test called DHT, dihydrotestosterone, that needs to be done along with iron studies, thyroid studies, and estrogen, progesterone, testosterone, things like that, to see what the balance of hormones is and see if a patient is low in those. And there also is a test in the office called SpectraCell, where we can check for vitamins, minerals, amino acids, and antioxidants. And when they are low, that's theoretically something also that can contribute to hair loss. Hair loss is a big thing for people. And as many women as men do come into the office for it. It's very simple. It just takes a couple of minutes of drawing your blood and getting stem cells and putting them into the scalp. So it's something that I do a bit of, not as much as the musculoskeletal work from head to toe. Well, that's literally the head, isn't it? But that's not musculoskeletal.
Right.
But all the orthopedic things that I do, and I've been doing for about 22 years, started at my training as a resident at UCLA in physical medicine rehabilitation, and I was on the surgical track. I wanted to be an orthopedic surgeon until I had one, and it kind of screwed me up. And then I jumped horses midstream and learned how to heal with modalities that are not as invasive. And personally, and from my experience and from the research, I think, and this is just little old Dr. Marc Darrow, I'm not telling you what you should think, and if there's a surgeon here listening, I'm not telling you what you should think. We should all think different, right? That's what makes the world go round. But I think the results with regenerative medicine are much higher than with surgery, and the sequelae or bad side effects are minimal. Very minimal. Typically, people will get stiff after I inject them for a day or so, but it's nothing like the infections that I see with surgery. It's nothing like the, I'll give you an example. One of the worst things I've seen, well, the worst actually was a woman dying on the table during surgery, probably from the anesthesia on a hip replacement. And that made me think twice about wanting to be a surgeon. I've seen way too many things happen in surgery that were not good for the patient. And, it's like the joke, the surgery was a success, but the patient died. So, yeah, the surgeries can come out great, and the people can have side effects from it. I saw one woman who was about 30 have a heart attack. She was going in for a back surgery and never got to the surgery because the anesthesia gave her a heart attack. So I'm not a proponent of surgery. I'm just putting it out there. If you come to me, don't ask what kind of surgery you should have. I'm going to tell you not to get one. I cannot remember the last time that I told someone they should have a surgery for a musculoskeletal complaint. ACL ruptures in the knee, as an example. The, quote, knee-jerk reaction, that's a pun, is to operate and put in a cadaver ligament or part of the hamstring tendon, put that in. And I don't find that most people who have an ACL rupture need to have a surgery. They do just fine. There have been a couple of cases over the years where people come in with an ACL rupture, that's anterior cruciate ligament in the knee, and they do need a surgery because that knee joint is so loose that it does need a surgery. But most people that have an ACL rupture do not have a loose knee. The muscles and the tendons and ligaments can hold that knee together just fine. There are many, many elite athletes and pro athletes with ACL ruptures that do not have to have surgery. So don't think if you have one of those that you need a surgery. Don't think if you have a meniscal tear in the knee or a rotator cuff in the shoulder or a labral tear in the shoulder or the hip that you need a surgery. Most likely you do not. You might, but most likely you do not. We heal those every day of the week just by doing an injection of cells taken from your body and replaced in the part that you're having pain. So I don't mean to be on a soapbox about my feelings about all this, but it's been my life work in medicine, and I started out on the surgical and the medicine, give them medicine, shut them up, give them physical therapy, and then do surgery if none of that worked, and that's how I was trained. But that's not where I am today, and I do what is empirical. That means what works. I'm an empiricist. I don't care what the medical book tells me or what other people tell me. I do what I find works. I use my hands to do the examination, and I don't really care that much about your images. I had a guy come in with about 30 pounds of MRIs, X-rays, and CT scans, and he wanted me to review them all, and I said, I'm not going to. I'm going to do an examination with you and find where the pain generator is. The pain generator is the thing on the surface or deep within that causes the pain. We get people that come in with terrible, terrible MRIs, and they have very minimal pain. And there are studies on people that have zero pain. We take people with no pain, we do MRIs, and guess what we find? Terrible things. So if you have some pain and you have a terrible MRI, the knee-jerk reaction again is for a surgeon to operate. And most of the time it should not, need not be done. So most things we can heal using platelets and stem cells. Some things we can't, obviously, and some things surgery is needed for. But it's very remote, unless you're a trauma surgeon. And, if you had a trauma and it's live or die, you better get that surgery immediately. If you have a broken bone, you might need that surgery immediately. But most of the orthopedic surgeries today should not be done, in my humble opinion. May I take another question?
You may, as soon as I give the phone number, 866-870-5752. That's right here at the station. You can speak directly with Dr. Darrow. That's 866-870-5752. And check out the website at www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site. and see him performing the treatments on video. And we are here Saturdays at 10 a.m., again at 1 p.m., and we still have time for your call. I have lines open for you, and don't call at the last minute because sometimes we can't get you on. So the number again is 866-870-5752, and you'll get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Fabulous. 264 studies. And the foreword is written by the wonderful Suzanne Summers, who's written a lot of books on her own, and you're in some of her books too, aren't you?
Yeah, thankfully, I the most recent book that Suzanne wrote, which let's see, I have it here. It's called A New Way to Age. There's a big chapter on me and regenerative medicine. So thank you, Suzanne Summers. I do love you, and all of us in the field of what's called alternative medicine love Suzanne Summer because she spends her life traveling around, going to trainings where doctors learn how to do these things, and she takes a lot of her time to help people. So thank you.
Shall we go to... oh, sorry, I didn't mean to cut you off. Did you want to go to Brad in Camarillo before we do another question?
Absolutely. By the way, Nita, you're not the first person to cut me off.
I'm clear.
It doesn't hurt my feelings.
Okay, good. Well, we've only worked together 12 years. It's okay.
Yeah, we're used to each other. Brad, this is Dr. Marc Darrow, and I understand your daughter has bone on bone. Is that in her knee joint or shoulder, hip, where?
Yeah, that's her shoulder joint. She was a college athlete, soccer athlete, and she tore ACL. Okay. She had 3 surgeries and a manipulation after, and now they're telling her she's bone on bone. She's 27, and she wants to be active, but she can't because of the pain, and just wondering what options she has to get back being active if in fact she's bone on bone.
Well, let me ask a couple questions first. Number one, you mentioned an ACL rupture in soccer, which is like the most common soccer injury, right? But most of those soccer players, believe it or not, don't need to have an ACL repair in the knee. And I don't know if you heard me in the first half hour of the show.
Yeah, I did. Yeah, I did.
You know, it's kind of yeah. Well, she may have needed it. You know, it just depends if the knee was loose or not. The studies show that it's best if someone does have an ACL rupture not to operate right away and to wait 3 months minimum to see how that knee fares and if it can heal up. So you did call about her shoulder, though, correct?
No, it's her knee.
Oh, it is the knee. I asked and you said her shoulder. I'm sorry. Her shoulder's fine?
No, it's the knee.
Okay.
Shoulder's fine. It's just the knee.
Okay, good.
Yeah.
How is her range of motion in the knee? Can she bend it? Can she straighten it?
She can bend. Yeah, she can bend it, but she can't. She can't run very well without a limp because it hurts.
Okay, just because it hurts though. But the range of motion is pretty good from what you're saying. Pain is something.
So,
yeah, pain is something that is usually pretty easy to fix using regenerative medicine. Now, if her knee was locked up and she couldn't straighten it or bend it, that may be a different story. There have been patients I have with no range of motion at all that I've used regenerative medicine on with stem cells or platelets who have regained some range of motion. But sometimes if a joint really is bone on bone and there is no cartilage left, which is not the case for your daughter, Brad, okay? She does not have bone on bone. I'm just going to say that without knowing her, just because you said she can run or walk or whatever with a limp because of the pain. That's not bone on bone. Bone on bone is a term that's used. I have to watch what I say here not to make people angry. It's by people who think someone should have surgery. So they terrify them with the term bone on bone. Do you get what I'm saying?
Yes.
Okay. So I get patients in every day of the week who are told they have bone on bone in the joint. and then I examine them, and the knee moves, or the shoulder, the fingers, whatever it is. It's all the same thing. Everything in the body is the same. We're made out of collagen. It's the structural protein of the body. And that's why regenerative medicine works so well anywhere I do it. I do it basically from the head all the way down to the feet, the bottom of the feet and everything in between. It's the same procedure. You got to know where to put the solution that's going to stimulate some tissue regrowth and grow back some collagen, cartilage, ligaments, tendons, whatever that is we're working on. But your daughter doesn't have bone on bone if she's moving that knee. The question is if I can help her. Most likely, yes. The chances are stupendous, but I would have to examine her. I don't care what other doctors have told her. Most doctors are telling people the wrong thing. I'm not saying I'm better than them. I'm just saying I use my hands to diagnose. I use the examination. When I ask patients who have had a failed surgery, did the doctor ever touch your body? Their answer usually is no. Why would they? They looked at my MRI or my X-ray and told me I need surgery. I don't think that's good medicine. What do you think, Brad?
No, I think you're right. If you can avoid it, I think you should do it.
That's right. Surgery has a lot of side effects. What I do doesn't. People get stiff afterwards. That's typically the worst that happens. It's just an injection. People walk in, they get injected, and they walk out, and they drive home. They don't need anyone to come with them. It's that simple.
That's great.
So, until I examine your daughter, I can't tell you anything except from what you've told me. I think she's a great candidate for getting PRP or stem cells, depending what you guys decide, based on what I tell you after an examination.
Right. All right. Very good. Very good. Thank you.
God bless you, Brad, and God bless your daughter. I think there's good hope that she'll be back running again. I don't know about playing soccer. Soccer's bad on the knees. What am I going to tell you? I've got a D1 soccer player who's 19 at Colorado College right now, and she gets banged up pretty bad. That's part of the sport. I've injected her many times.
Thanks
well,
for your
she's done
call.
with that. She's 27. She just wants to live a normal life and do normal activities and hike and without it being painful.
Well, the odds are way, way in her favor if she gets platelets and stem cells if she needs it, that she'll be back in business again, doing all those things. Nita and I have a very close friend named Terry, who has a radio show on KPFK, and many, many, many years ago, he came in. He went to Harvard and played intramural football, injured his knee, and back in those days, they cut out the entire meniscus. They didn't mess around. And when he came in, I did an X-ray, and the femur and the tibia did not even line up. That knee was shot. In other words, the one bone did not even line up on the other. And we did a series of injections, and he was back to dancing, which he loved to do, and hiking and yoga. And I don't know how he's doing today. I haven't talked to him in years and years and years. Nita, do you ever see him at the studio there?
He's doing more work on his private podcast, actually. I don't think I've seen him for about 2 years, but he's in good shape. I mean, he's always mentioning you and how grateful he is because...
Well, that's amazing, yeah.
Because he's an active guy like you, so...
Yeah, so if someone like Terry can get better from this stuff, who basically had minimal anything left in his knee, I think your daughter can do pretty darn good, Brad.
Okay, very good. Yeah, I want to check it out then.
Thanks for your call, Brad.
I'm going to give Terry a
All
call
right.
today.
Yeah, thank you, guys.
You're welcome. And our number is 866-870-5752. And what were you saying a second ago? I think I cut you off. I'm sorry.
No, it's okay. I like that. I'm in training.
Well, I am also one of your patients from 16 years ago because you got me out of trouble with my neck and shoulder problem. And I think that you saved me from surgery. There's no question in my mind.
Well, it's what I jokingly say, it's the white horse I ride. And like I say, it's not going to work on everybody, and usually that's the patient's fault. If I think a patient can heal from this, they usually can if they stick to what's needed to be done. And that is basically to let it rest until it heals and get enough treatments so there's enough tissue that can be grown. And I don't control the karma department of how people do. And the main question I'm asked every day is, how soon, Doc? And I tell them that depends on you quite a bit. Depends if you can stay off of it. I have patients who have 3-story houses, and they'll have foot pain, and I'll inject it, and then they go up and down the stairs all day. And I tell them ahead of time, don't do that. Mm-hmm. And they do it anyway. They go, well, my shower is up on the 3rd floor. I go to the gym to shower. Go to your friend's house to shower. Do what you need to do. Leave it alone if you want to heal. Pretend you had a surgery. If you had a surgery on your foot, you're not going to be running up and down the stairs.
That's right. Well, we still have a couple minutes left. You can call us at 866-870-5752. That's 866-870-5752. Lines are open for you right now. You get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 scientific studies. And you also do some hair growth stuff in the office.
Yeah, as an adjunct to the work I do with platelets and stem cells on the physical body, meaning the musculoskeletal system, the joints, the ligaments, and the tendons, all the way from the back of the head down to the bottom of the feet, every joint included, every ligament, tendon. I've done the whole body over the years. We do grow hair. I know that sounds crazy, but patients love it. I use the same treatments, but on the top of the head. So it works pretty good. So if you're losing hair, and this is women or men, it doesn't matter. I get just as many women as I do men for hair regrowth treatments. I'll typically check your hormones and check your vitamins, minerals, antioxidants, things of that nature, and make sure you're balanced. That's important. It's important to be healthy, to grow hair, and to heal anywhere around the body. It's a good thing to be tuned up health-wise. It's a good thing to lose weight. If you're overweight, obviously if you've got lower extremity pain, you better drop the weight. I can show you how to do it real easy. You just drop carbohydrates. One of my very best friends on the planet, who I've known for close to 50 years, skyrocketed up to 315 pounds.
Ouch.
And he now, after about a month, is down to, I make him text me every morning. He's down to about 280. 280 is still a lot.
Yeah.
He's not a giant boned guy, about 6 feet tall, very handsome dude. And we're going to get him back to how he was when I first met him 50 years ago, and he is on track.
Well, we are totally out of time here, so if you were thinking about calling, go to the website, which is lastemcells.com. Remember to listen to The Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday. Thank you, Dr. Darrow. Thank you, Alex. Thank you, Suzette. I'm your host, Nita Valens, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, To take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.